Hello, my name is Carol White. I'm a professor at the School of Nursing, and I lead the Caring for the Caregiver program. I'm going to talk to you today about dementia and try to provide you a more fuller understanding of that diagnosis. Often caregivers come to me and say, we received this diagnosis, but we didn't receive really any information to help us understand it. So I hope by listening to today's presentation and then our discussion afterwards that you'll have a better understanding when you leave. So what is dementia? It's not a specific disease. It's rather the name for a group of symptoms that occur when the brain is affected by a disease. Similar to when you have problems with your heart and you have heart failure, when people have a decline in their cognition or brain failure, that's really what dementia is describing. So it's symptoms that are associated with the decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Dementia is not a normal part of aging. While age is the greatest risk factor for dementia, it's not normal that all people who age will necessarily have dementia. So while symptoms of dementia can vary greatly, at least two of the following core cognitive functions must be significantly impaired: memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. People often think about dementia as really only being memory, but you can see that as the brain is more impaired, communication goes, people have problems with insight and judgment, and also visual perception. I just want to talk for a minute about mild cognitive impairment, or MCI as people might call it. It's a cognitive decline that's abnormal for your age and your education, but it doesn't interfere with daily life or independent function. So you may know there's something going on, but it may not be evident to other people unless you tell them. And it's prevalent for approximately 10 to 25% of people age 65 or older. And it is a risk factor. We know it's a risk factor for dementia, but it doesn't always lead to dementia. And in some individuals, MCI can revert to normal cognition or remain stable, particularly if the reason for the cognitive decline can be investigated. And so that's why it's important for people experiencing cognitive impairment to seek help as soon as possible, and also to look for possible treatment. Just want to go quickly through, this is from alz.org, through what people often wonder: what's early signs and symptoms of some form of dementia, and what's normal aging. And what you probably will notice here is they're all similar, but what really is different is the magnitude of the signs and symptoms. How disruptive are they really, and how frequently are they happening? So for example, all of us may, especially in days of COVID when we're working at home a lot, may be confused with the time or the day, but may occasionally forget it, but having confusion more frequently with time or place is indicative of something that's beyond normal aging. Similarly, making occasional errors when balancing a checkbook is not uncommon for all of us. But if a person is having significant financial problems or challenges in planning or solving problems, this now is more indicative of something that is not normal, but could be early signs or symptoms of some form of dementia. Similarly, on the next slide here, you can see occasional problems with finding the right word happen to all of us, but then new problems, and I think particularly if it's beyond what people were experiencing before, happening more frequent, of greater magnitude in terms of writing or speaking, is a warning sign. Withdrawal from work or social activities. All of us sometimes are weary of some of our obligations and would like to just take some time to ourselves, and that's part of our normal lives, normal aging. But when you see people withdrawing more and more, that is not normal aging. So all of these are important warning signs that need to lead you to further investigations. So just to talk a little bit about dementia, and often people talk about dementia and talk about the fact that they're so relieved they have dementia, not Alzheimer's disease or something like that. But just to remember, dementia is actually an umbrella term. So just like everybody that has breast cancer has cancer, everybody that has cancer doesn't necessarily have breast cancer. So in the same vein, everybody that has Alzheimer's disease, it's one form of dementia, but everybody that has dementia doesn't necessarily have Alzheimer's disease. People often use dementia and Alzheimer's disease interchangeably because, as you can see here, Alzheimer's disease is the main cause of dementia among adults. And when I talk about the main cause, what I need to say is the main irreversible cause of dementia. So you can see there's many causes and the list goes on. I've listed some of the more common things here. And we're really going to talk today about Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal. And you can see they make up the most common reasons for somebody having some form of dementia. When you go to see a doctor about some of those signs and symptoms that we were talking about and people have concerns, part of the workup is really to say, are there things that we can treat? Is there something else going on? Something with your thyroid, maybe it's your B12. And so they do a number of tests, first of all, to rule out treatable causes, and then to eventually come to a diagnosis of Alzheimer's disease, vascular dementia, Lewy bodies, or frontotemporal, or something else that you see here. The other thing to add to this picture is generally people don't have just Alzheimer's disease or vascular dementia. Particularly as they age, you're more likely to see, particularly on pathology, a mixed type of dementia. And because a lot of the risk factors for vascular disease and Alzheimer's disease are similar, it's not uncommon that people may have a mixed dementia. So Alzheimer's disease falls under what we would call neurodegenerative diseases, so really meaning degeneration of your neuron, cell death, as we talked about brain failure. And it affects right now about 5.8 million people in the US and 50 million people worldwide. And we'll talk a little bit more about the numbers on a further slide, but it is, we know that it's higher in low and mid-income countries than in high-income countries. And we also know that even though the numbers are rising for Alzheimer's disease just because of the aging of our population, because of better risk factors, the incidence, meaning how many new cases or the actual incidence, is going down, but there'll be more people living with it because of age. It mostly affects people over age 65. And people think about dementia usually as a memory problem or Alzheimer's disease. And you can see there are many other symptoms and memory is important, but difficulty concentrating, doing simple math, forgetfulness, disorientation. But you think about what we need to remember and how if something looks new all the time, how it's going to affect so many of our other functions. So what causes the cognitive deficits in Alzheimer's disease? At the end of the day, it really is cell death. And you can see here a healthy brain that's puffed out, and then a brain with severe Alzheimer's disease. And you can see how shrunken it is because of the number of cells that have died related to this pathological process. And often starting out with loss of neurons in certain regions, and people talk about the hippocampus, where really is where we lay down memories, but then going to other parts of the brain, affecting messages that are being transferred between different cells, and then affecting brain networks. And you may see, as it says here, some hyperactivity in the hippocampus, which is really the area where we think about memories, and it may be that abnormal activity that's taking place with the proteins that leads to that hyperactivity. So what are those proteins that are believed to cause Alzheimer's disease? The ones that you've probably heard about and you hear most common are beta amyloid and tau, which somehow become toxic to the brain. They really are proteins that play essential role in neuronal growth and repair and stabilizing the cell, but they become corrupted, and then eventually you have these beta amyloid plaques that are building up between cells, blocking the messages. And then you have tau, which is really meant to stabilize structures in the cell, but it clumps together, forms long filaments that disrupt the brain's ability to communicate with other cells. If we look at the picture here, you can see the tau tangles accumulating within the cell, so the messages aren't able to be transferred along the cell, the axon, and then you see these clumps or plaques of beta amyloid building up. So you can see eventually destroying the cell, and people are not able to pass messages from one neuron to another, which is really what helps us to be able to think, to do our communication, our motor activities, sensory. So you can see those, just a pictorial of what is happening in the brain. So why are more people getting Alzheimer's disease? Certainly, people are living longer, and you can see here, as we age, at about age 65, 1 in 10 people will have a diagnosis of Alzheimer's disease, but when you get to 85 plus, it's between 1 in 3 and 1 in 2 people will have some form of dementia. So increasing exponentially with age. So as our population is aging, living longer, and you can see the life expectancy going up here, unfortunately more people are going to be diagnosed with some form of dementia. So the idea is, how can we give people, and that's really the thought about prevention, how can we, even if we could change this curve by 5 years, could we give people more time without succumbing to a diagnosis of some form of dementia? The other reason is we've been doing so well with all these other diseases. You look at heart disease going down, whether you're looking at white or black females, you look at stroke, no matter where you're looking across the country, you can see stroke deaths going down tremendously. And similarly with cancer, again, no matter where you're looking at in the country, you can see the number of deaths from cancer are decreasing, but we don't yet have disease modifying therapies. We know some things about prevention to stop people who are living longer from having a diagnosis or for having a form of dementia. So just to talk about Alzheimer's genetics, and it is a genetic disease, there really are 2 types people talk about: early onset and late onset. And by and large, early onset is relatively rare. Late onset meaning an onset of symptoms or diagnosis. And it really is the diagnosis, because we know that the symptoms or what's happening in the brain start years and years before the diagnosis. So late onset meaning 65 or later, early onset being before 65. And so, and you can see here, symptoms first appear in a person's mid-60s. They appear between a person's 30s and mid-60s. This is, as we said, most common and may involve a gene called ApoE4, which is a risk factor for dementia, for Alzheimer's disease. It doesn't mean that you'll get it, but it does increase your risk. And then for early onset, there's a more of a deterministic gene that is usually passed from family to family. And there's been these family studies that have looked at people living with the diagnosis of early onset and see these genes passed family after family. So just talking about ApoE, the E4 gene, I'm just trying to see if I can move my picture here so you can see this. Doesn't seem to be moving. You can see here that people having both alleles in the population, it's very rare. ApoE3 almost seems to be protective in fact. And sorry that my picture is blocking this this slide here, but you can see if you had both alleles of the ApoE4 gene, it's very rare in the population, 1 to 2%, but it increases drastically your risk of developing Alzheimer's disease by age 85. Here I just want to look at what they call a life course perspective on risk factors for dementia. And so, as I said, we know that what's happening in the brain probably is happening 20 years before you're really seeing the symptoms. So in 2017, they published a very important paper that looked at all epidemiological literature to look at what are some of these risk factors for dementia. And they looked at, of course, the ApoE4 gene, but more importantly, looked at what kind of things can we actually do something about. So they looked at education as part of an early life course risk factor, meaning that less education is a risk factor, more education is protective. In midlife, hearing loss came up as important, hypertension, obesity, and then in late life, smoking, depression, physical inactivity, social isolation, and depression. So you can see some of the things that we know what's good for the heart is good for the brain are important risk factors that we can actually do something about. Hearing loss they weren't sure about, but this year I was just on the Alzheimer's Disease International Conference, virtual conference, and they talked about some studies where people who are wearing hearing aids actually are not at the same risk because they weren't sure what was the relationship. So it may be related a bit to the social isolation and the depression, but we know a large number of people, at least half the population over 65, has some form of hearing loss, but a very small percentage of the population wears hearing aids. So this is an important risk factor to be thinking about. If we really were spreading people wearing hearing aids, could we reduce the risk of people having cognitive impairment? So then other risk factors we know, and this is particularly important because people with Down syndrome have not lived as long as they live now, but we know that they are at risk because they already have changes going on in their brain. They are at risk for an Alzheimer's disease pathology as they're living longer. And then you've all seen the news about head injury, football players, repeated head injuries, and the risk for developing Alzheimer's with those repeated injuries. So just some of the numbers we were talking about, over 5 million, 5.8 million people living. Alzheimer's disease doesn't just affect the individual living with dementia, more than 16 million family caregivers, and the 6th leading cause of death overall. And for older adults, 1 in 3 older adults dies with the diagnosis of Alzheimer's or another form of dementia. So important numbers. And then talking about Texas alone, in 2020, there were about 400,000 Texans living with the diagnosis of Alzheimer's, and we know that's going to increase. We're already in 21 by 25 to almost 500,000, a 22.5% increase, and over 1.4 million family caregivers who provide a tremendous amount of unpaid care. You look at the total value of that unpaid care, $21 billion of care that they provide to support families in Texas alone. So just talking about the other forms of dementia as well, vascular dementia, very related to stroke. And you saw those risk factors we talked about for Alzheimer's disease, which also put people at risk for vascular dementia. And so hypertension in particular, and we know that controlling blood pressure in midlife is now become one of the most important risk factors, and one of the most important things we can do to prevent cognitive decline. So similar to stroke, vascular dementia happens when we're getting too little blood to the brain and cells are dying. And often with vascular dementia, you're talking about strokes, smaller strokes, more deep in the brain, which one stroke may not make a difference, but if you have the accumulation of these small strokes, that is going to lead to cognitive decline as well. And that's really what they're talking about when they're calling it vascular dementia. You also may have post-stroke dementia, where someone has a fairly significant stroke, and just because of the area in the brain that's been affected, they may also have some forms of cognitive decline as well. So vascular dementia, particularly in South Texas, where we have diabetes, uncontrolled hypertension, is a very important risk factor for dementia, whether it's for Alzheimer's or for people getting vascular dementia and at a younger age. Dementia with Lewy bodies, you saw, is around 10 to 15% of causes, irreversible causes of dementia. And Lewy body is often associated with Parkinson's disease. And there's abnormal deposits of a protein called alpha-synuclein in the brain. And these deposits, called Lewy bodies, affect chemicals in the brain, which then lead to problems with thinking, movement, behavior, and your mood. And so you can see when we're talking about movement, we really are thinking about Parkinson's disease as well. And so it may be that people start with some form of cognitive impairment, but later progress to have more of the typical signs of Parkinson's disease. So we'd be talking about dementia with Lewy bodies, or it may be that someone exhibits some of the signs and symptoms more typical of Parkinson's disease, but over time with Parkinson's, a large percentage will also have some cognitive decline. So you can see the relationship between the two. And so it affects different regions in the brain that control many of the functions related to thought in the cerebral cortex, your language. It also affects the limbic system, which is believed to be related to our emotions and behaviors. The hippocampus, which we talked about with Alzheimer's, that's important to forming new memories. The midbrain and basal ganglia, which have to do with movement. So you can see widespread throughout the brain, and then the brainstem, which is important for regulating alertness. And then people have often talked about problems with smell as well. So some of the clinical features related to where the Lewy bodies are accumulating can be hallucinations. So you see, with Alzheimer's, we talked about memory first. With dementia with Lewy bodies, we may be talking about visual, different kinds of hallucinations, more generally visual, movement disorders, similar to what we talked about with Parkinson's. And then because of the involvement of the autonomic nervous system, people can have tremendous problems with blood pressure, a lot of postural hypotension, low blood pressure, difficulties with their pulse, sweating, and then constipation can be a very serious problem with dementia with Lewy bodies. And then also, as we talked about, some of the cognitive problems, memory, confusion, visual spatial problems. Sleep difficulties are often more of a characteristic of dementia with Lewy bodies. And then some of the mood disorders, apathy, fluctuating attention, and depression. So not as common as Alzheimer's disease, but nonetheless, or vascular dementia, but an important cause of dementia. And then the last one we'll talk about is frontotemporal dementia, which, as the name talks about, it's affecting our frontal lobes and our temporal lobes. And the symptoms that we see result from progressive degeneration of those areas of the brain. So often those are to do with our behavior, our mood. And so we'll talk about the clinical characteristics in a moment. But in people who have some form of dementia under 60, this is the most common cause. And often it's not recognized as a dementia because of the changes in behavior, but not the memory loss. So these are people that may lose their job, they may lose their family support because of their behavior, their impulsivity, their apathy, their loss of sympathy or empathy. They may end up with people that have very challenging lifestyles because they didn't get a diagnosis and they're and really find out what was going on. They lost that support. Language dysfunction is also common, and then some problems with their movement. But you see here that memory hasn't come up as a big feature. It will be part of it over time, but it really often stays relatively intact. But with their communication problems, people may not understand that their memory does seem to be okay. But it's really the behavioral features that are so difficult for the person and for the family. So all this to talk about how important an early diagnosis is. While we still do not have any disease-modifying therapies, we have a few drugs. Hopefully, there's some hope of new drugs coming out, but there are many advantages to an early diagnosis. Certainly, if you can catch things early, we know controlling blood pressure, exercise can help with your cognition. We also know the importance of social interactions. So those kind of things that you can be taking advantage of, some of the things that we offer in the Caring for the Caregiver program. But a better chance, there's many more clinical trials going on now, many at the bigs that are, some of them aimed at people in early stages. So the opportunity to participate in some of these trials, not only potentially to help yourself with some of them, but to learn more about or to help others. An early diagnosis can give you time to plan for the future, to think about what is it as your loved one is still able to be autonomously involved in decision making. What kind of things do we want to move forward for in the future? And also to not become fixated on the diagnosis, because this in most cases is a diagnosis that takes place over time, but to think about living and what do you want to do? What are the things you want to be able to accomplish within your lifetime? Time to develop a relationship with doctors and caregivers, and then to be able to benefit from the care and support services that are available. And as I talked about the Caring for the Caregiver program, we have a number of programs along with our collaborators in the city. So just to talk about the diagnosis, there isn't a single test, but it's a combination of tests, a thorough medical history, neurological exam, cognitive testing, and then a number of other blood tests, cerebral spinal fluid, potentially different imaging. And some people will undergo PET scan where they are able with, they have tracers that show the beta amyloid or the tau, but just an idea of the diagnosis. And then finally, the importance of finding a care team that you feel comfortable with that can help you on this journey. No one wants to be doing this journey alone. So important to be having your care team, including the healthcare professionals. And just as you know, this is a progressive condition. And here we just talk about the stages. There are a number of different ways of staging it, but just generally to say that in early stage, people still can be fairly independent. In mid stage, needing some help with their activities of daily living and independent activities of daily living, ADLs and IADLs, and then towards end staging, needing almost 24-hour care to needing 24-hour care. But the primary goal of treatment is to know what are your goals for care, and then to work with you to be able to enhance the quality of life of the family that's been impacted by a form of dementia. And so just in closing, just to quickly talk about, we talked about the life course. This was just published now in 2020 about the different ways that one can reduce risk of developing dementia. We talked about the things related to vascular health, diabetes, hypertension, smoking, obesity, exercise, alcohol, now they've added, and then the importance of social interaction, um, um, reducing depression and high frequent social contact. And then we talked about hearing impairment and the importance of testing hearing impairment. And then the American Heart Association has Life Simple 7, which addresses all those things: smoking, heart health, your cholesterol, your diabetes, diet, weight, and exercise. And then finally, there have been some important prevention trials. This was in Finland, called the Fingers trial, that looked at a multi-component intervention. This was not when these were people that had a high risk. They did not have MCI or mild cognitive impairment, but looking at some of the risk factors that they had for progressing to that: healthy diet, exercising regularly, and taking part in social events. So there is hope on the horizon for really focusing on prevention, but it's not helping the 50 million people right now, but there are so many things that we can do to support family care that we didn't do in the past. And so, and I think what you're doing today in terms of coming and learning more about a diagnosis of dementia is very important. And then just a little bit about enrolling in clinical trials and how important that is. So just to end with this this quote, it occurred to me at one point, it was like I had two diseases. One was Alzheimer's and the other was knowing that I had Alzheimer's. So as I said before, the importance when you have a diagnosis of looking at how can you focus on living and how can we support you in doing that. So thank you so much for listening to